Your doctor might often stress the importance of watching your carbs, taking your meds, or checking your blood sugar levels. But there's one critical area that rarely comes up: vitamins. These tiny but mighty nutrients power your metabolism, help insulin do its job, shield your nerves, and prevent long-term complications. The surprising truth? Most people living with diabetes are deficient in several key vitamins, and they don't even realize it. In today's breakdown, we'll explore the top 4 vitamins every diabetic needs to know about. If you've been feeling constantly drained, battling nerve pain, or struggling to manage your blood sugar and A1C despite doing everything right, this information could be a game changer. Stay tuned, because I'll also show you the most effective food sources and supplements to quickly correct these deficiencies. Let's start with number 1, vitamin A. Vitamin A deficiency is a silent but serious issue for many people with diabetes. It's not just about what's on your plate. Elevated blood sugar levels and chronic inflammation interfere with the way your body processes vitamin A, especially converting it into its active form, retinoic acid. On top of that, insulin resistance blocks vitamin A's critical function in your pancreatic beta cells. This reduces insulin secretion and makes blood sugar control even tougher. For those with kidney disease, the problem worsens. Damaged kidneys lose the ability to properly regulate vitamin A levels, speeding up depletion. Many diabetics also suffer from gut issues, which hinder fat absorption and, since vitamin A is fat-soluble, you need healthy digestion and bile flow to absorb it. Some medications, like Orat and Chamine, further interfere with this already delicate process. Symptoms of deficiency often creep in slowly. Fertility can drop. Vitamin A is essential for sperm formation, egg development, and embryo implantation. Low levels are also linked to increased miscarriage risk. Libido may decline as vitamin A plays a vital role in testosterone production and reproductive tissue health. Your nervous system suffers too. Without enough vitamin A, nerve damage progresses more quickly and regeneration slows, worsening neuropathy. Your kidneys, already vulnerable in diabetes, lose protection from oxidative stress, speeding up their decline. Your eye zone of the most obvious targets can develop night blindness, chronic dryness, or an increased risk of diabetic retinopathy. Your heart can weaken, as vitamin A is necessary for strong heart muscle function and maintaining the flexibility of blood vessels. Deficiency here can lead to high blood pressure and increased risk of heart disease. Mental health also takes a hit. Vitamin A regulates dopamine and serotonin pathways, so when levels drop, symptoms of anxiety and depression often follow. Weight gain becomes easier because retinoic acid regulates fat metabolism. Without it, your body tends to store more fat and burn less. Blood vessels grow stiff and more prone to damage, raising the risk of ulcers and slow-healing wounds. According to research, up to 30% of diabetics are deficient in vitamin A, especially those battling kidney disease or chronic inflammation. At the cellular level, vitamin A acts like a genetic switch. It regulates insulin sensitivity, boosts immune function, and supports cellular repair. It's also essential for pancreatic beta cell health, helping your body adapt to changes in blood sugar. When you're low, cellular healing slows, oxidative stress increases, and insulin resistance worsens. Now, let's talk about food. When it comes to natural sources, beef liver is king. Just 3 ounces, about 85 grams, give you a staggering 1,149% of your daily vitamin A intake. Cod liver oil is even more potent, delivering over 4,500 IU per tablespoon, 14 grams. 2 large egg yolks provide around 24%, while a tablespoon of butter from grass-fed cows offers about 11%. Wild-caught salmon is another solid choice, giving you 25% of your daily needs in a 6-ounce, 170-gram serving. If you enjoy indulgent meals, there are luxury options too. Foie gras with saffron-infused cod liver sauce provides over 5,000% per 100 grams. A Wagyu steak topped with bone marrow butter and egg yolk sauce, gives you 1,500% per serving. And king crab bisque with wild salmon roe packs, around 1,200% a decadent way to replenish your stores. When it comes to absorption, retinol from animal-based sources is far superior. It absorbs at a rate of 80–90%, while beta-carotene from plants is poorly converted, especially in diabetics with digestive issues, where absorption may be as low as 3–6%. For supplements, Carlson cod liver oil, 4,500 IU per teaspoon, and Thorne's vitamin A, 3,000 IU from retinol per capsule, are top choices. Both are highly absorbable and effective for diabetic support. It's also important to know which foods may worsen deficiency. Processed vegetable oils, high fructose corn syrup, and excessive alcohol consumption can deplete your vitamin A stores over time. If you're noticing poor night vision, dry skin, or more frequent infections, you may be dealing with an overlooked vitamin A deficiency. The good news? Addressing it can strengthen multiple systems at once, from your nerves and kidneys to your eyes, heart, and metabolism. Next, we'll move into another essential vitamin that diabetics often lack on that plays a huge role in fertility, nerve health, and heart protection. Let's talk about vitamin B9, also known as folate. Number 2. Folic acid, vitamin B9. Folic acid, also known as vitamin B9, is absolutely essential for people living with diabetes. Yet, surprisingly, deficiencies are far more common than most realize. High blood sugar levels, and medications especially, metformin, significantly lower folate by reducing how much is absorbed in the intestines and by increasing how much is lost through urine. On top of that, chronic inflammation from diabetes disrupts folate metabolism, while oxidative stress burns through it faster than usual. Poor dietary habits or complications like kidney disease only worsen the problem, often leading to a persistent folate deficiency that creeps in silently until the symptoms become too big to ignore. A shortage of folate throws nearly every major system in your body off balance. Fertility suffers in both men and women. Low folate levels impair sperm quality and hinder egg development, raising the risk of miscarriage. Libido often takes a dip because folate plays a key role in nitric oxide production, which is vital for healthy circulation and arousal. The nervous system starts to decline as well, leading to numbness, tingling, and worsening diabetic neuropathy. Kidney health, which is already fragile in diabetics, can rapidly deteriorate. Folate helps regulate homocysteine, an amino acid that in excess causes kidney tissue damage. Eye health also takes a hit. Folate deficiency increases oxidative stress in retinal cells, accelerating diabetic retinopathy. Meanwhile, the heart faces serious risks. High homocysteine levels stiffen the arteries, raise blood pressure, and increase the chance of strokes or heart attacks. Mental health isn't spared either. Mood swings, anxiety, and depression often intensify because folate is critical for producing serotonin and dopamine, your feel-good neurotransmitters. And when it comes to metabolism and weight, folate plays a subtle but powerful role. A lack of it can slow down fat metabolism, encouraging fat storage. Over time, your blood vessels can stiffen and weaken, worsening diabetes-related circulation issues and increasing the risk of ulcers and slow-healing wounds. While the rate of deficiency varies, research suggests that up to 40% of diabetics, especially those taking metformin, have low folate levels. At a cellular level, folate is the fuel behind methylation, a biochemical process essential for DNA repair, detoxification, and proper gene expression. When methylation is disrupted, inflammation rises, nerve function deteriorates, and cells begin aging faster than they should. Folate is also vital for red blood cell production, helping prevent anemia, something quite common among diabetics with kidney problems. When it comes to food sources, beef liver tops the list. A 3-ounce, 85-gram serving delivers an impressive 54% of your daily recommended intake. Cooked dark leafy greens like spinach offer about 33% per 1 cup serving, 180 grams, while asparagus provides 22% per cooked cup. A whole avocado, 200 grams, contributes roughly 20%, and a single cup of cooked lentils, 198 grams, packs a whopping 90%, making lentils one of the richest plant-based folate sources available. For luxurious folate-rich meals, you might enjoy foie gras with truffle-infused lentil puree, delivering over 150% of your daily needs per serving. Wagyu beef liver pâté with avocado mousse offers around 120%, while a gourmet spinach and asparagus soufflé topped with Gruyere cheese provides about 100%. These dishes aren't just indulgent, they're powerful tools for improving your folate levels. Bioavailability, or how well your body absorbs folate, can vary. Animal sources like liver are highly absorbable, while plant-based sources are a bit less efficient, though cooking helps make their nutrients more available. For supplements, the best choices for diabetics are methylfolate, 5-MTHF, and folinic acid, both of which are better absorbed than the synthetic form found in many over-the-counter multivitamins. Leading options include Thorne's 5-MTHF, offering 1 mg per capsule, and Pure Encapsulations Folate 400 mg capsules. For most diabetics, 400 mg to 1 mg daily is a good range, though those with kidney disease or elevated homocysteine may need more under medical supervision. Be mindful of certain foods and habits that worsen folate deficiency. Alcohol, processed grains, and too much coffee can block absorption. Diets high in sugar and unhealthy fats increase oxidative stress and deplete your folate stores even faster. So, if your energy is crashing, your mood is swinging, or your nerve pain is getting worse, folate deficiency might be the silent culprit. Addressing it could be one of the most impactful changes you make. Now that we've uncovered the power of folate, let's turn our attention to another critical nutrient for diabetics: iron. It may not be a vitamin, but its role is just as vital. Number 3. Iron. Although iron is a mineral, not a vitamin, it absolutely deserves a place in this conversation, especially when we're talking about diabetes and folic acid. Iron deficiency is surprisingly common in people with diabetes, and it goes far beyond simply not eating enough iron-rich foods. Chronic inflammation, which is often present in diabetes, triggers the overproduction of hepcidin hormone that actively blocks iron absorption in the gut. Kidney disease makes the situation even worse by lowering levels of erythropoietin, a hormone vital for red blood cell production. To add to the challenge, metforminone, of the most commonly prescribed medications for type 2 diabetes, interferes with how your body absorbs iron. Frequent blood sugar spikes can damage red blood cells, leading to even greater iron loss over time. Many people with diabetes also experience digestive problems, such as low stomach acid or gut inflammation, both of which impair the body's ability to absorb iron efficiently. The symptoms of iron deficiency tend to sneak up slowly. At first, you might just feel tired more often than usual. But over time, that fatigue can evolve into dizziness, pale skin, cold hands and feet, and persistent headaches. Fertility is another area where iron plays a major role. In women, low iron levels can disrupt ovulation. In men, it can reduce sperm count and quality. Libido often declines as well, since iron is essential for delivering oxygen to tissues, including those involved in arousal. When the nerves don't get the oxygen they need, they start to misfire, leading to symptoms of neuropathy like tingling, numbness, or restless legs. The kidneys, already vulnerable in diabetics, are hit hard when iron levels drop. Low iron leads to renal hypoxia, lack of oxygen in kidney tissue that accelerates nephron damage. Eye health also deteriorates. Iron is crucial for retinal function, and a deficiency can worsen diabetic retinopathy. The heart, perhaps more than any other organ, suffers greatly. Without enough iron, the heart has to work harder to pump blood, which can lead to tachycardia, irregular heart rhythms, and even heart failure in severe cases. Mental health can spiral too. Iron is essential for producing dopamine and serotonin, 2 neurotransmitters tied to mood and motivation. When levels drop, anxiety and depression often increase. On a metabolic level, things slow down. Iron supports mitochondrial function, the engines of your cell sand. When iron is lacking, energy production plummets. Blood vessels grow weaker, circulation worsens, and the risk of high blood pressure and blood clots increases significantly. Studies estimate that up to 30% of diabetics suffer from iron deficiency, especially those who also have kidney disease or take metformin. On a cellular level, iron is absolutely critical. It forms the backbone of hemoglobin, the molecule that carries oxygen to your cells. Without enough iron, cells literally suffocate. This leads to cognitive fog, slower wound healing, and chronic fatigue. Iron also fuels cytochrome enzymes in the mitochondria, so when iron is low, your energy levels crash hard. When it comes to food, beef liver is the gold standard. A 3-ounce, 85-gram serving provides about 36% of the recommended daily intake. Oysters are another iron powerhouse, offering roughly 44% per 3-ounce portion. Sardines, often overlooked, deliver 34% per 3.2-ounce, 92-gram can. Grass-fed beef contributes 22% per 3-ounce serving, while spinach, a plant-based option, contains 20% per cooked cup, 180 grams. It's worth noting that its iron is less bioavailable due to oxalates that block absorption. Looking for gourmet options? Try foie gras with oyster reduction. This dish alone delivers over 100% of your daily iron needs per serving. A Wagyu steak with sautéed spinach and bone marrow sauce packs around 80%. Or enjoy a Mediterranean sardine and lentil stew infused with saffron, offering 75% per serving and combining both heme, animal-based, and non-heme, plant-based. Iron, for enhanced absorption. Iron from animal sources called heme ironous absorbed much more efficiently at rates of 15 to 35%. Plant-based non-heme iron, on the other hand, is only absorbed at 2 to 20%, and that's heavily influenced by your gut health and any inhibitors present in your diet. To boost absorption, pair plant-based iron sources like spinach or lentils with vitamin C-rich foods. Think lemon juice, bell peppers, or strawberries. The best iron supplements for diabetics include Thorne's Ferrosorb, with 25 milligrams of iron bisglycinate per capsule, a highly absorbable form, and Pure Encapsulations Iron C, which combines 15 milligrams of iron with vitamin C to improve absorption. However, be cautious. Certain foods and drinks can block iron uptake. Dairy products, excessive coffee, and tea contain compounds that interfere with absorption, while processed grains strip away much of the natural iron content. So if you're dealing with fatigue, brain fog, or worsening nerve pain, don't overlook the possibility that iron deficiency could be silently undermining your progress. Addressing this one nutrient could dramatically change how you feel, think, and function. Up next, we turn to a nutrient that plays a central role in nerve, health, energy production, and red blood cell formation: vitamin B12. Let's explore how vital it is for diabetics and why so many are running low without even realizing it. Number 4. Vitamin B12. Vitamin B12 deficiency is a major issue among people with diabetes. Most don't realize it until serious symptoms begin to surface. One of the biggest culprits? Metformin. This commonly prescribed diabetes medication interferes with B12 absorption in the gut by blocking calcium-dependent transport. Over time, this results in a slow but steady depletion of B12 levels. But metformin isn't the only factor. Chronically high blood sugar and ongoing inflammation, both common in diabetics, damage the stomach lining and reduce the production of intrinsic factor, the protein necessary for B12 absorption. Add kidney disease to the mix, and the situation worsens. Damaged kidneys can't reabsorb B12 efficiently, causing even more of it to be lost through urine. Gut issues, such as low stomach acid, H. pylori infections, or an imbalanced gut microbiome, can further block absorption. Because vitamin B12 is found only in animal-based foods, people on plant-based diets or with poor nutritional habits are at even greater risk. And unfortunately, B12 deficiency is sneaky. It often shows up subtly with fatigue, brain fog, memory problems, dizziness, or tingling in the hands and feet long before a diagnosis is made. Fertility suffers too. B12 is essential for sperm count, motility, and egg development, and low levels are associated with an increased risk of miscarriage. Libido drops as well, since B12 is required for healthy red blood cell production and oxygen delivery, both key for energy and arousal. Nerve problems escalate. Without enough B12, nerve insulation, called myelin, breaks down, worsening diabetic neuropathy. The kidneys also take a hit, as B12 helps lower homocysteine, an amino acid that can damage kidney tissues when elevated. Vision may blur, because B12 deficiency increases the risk of optic nerve damage and retinal issues. The cardiovascular system is also vulnerable. Elevated homocysteine from low B12 levels contributes to artery damage, increasing the risk of heart disease and strokes. Emotional health declines as well. B12 is needed for serotonin and dopamine production, and without it, anxiety and depression can intensify. Weight issues are another consequence. B12 supports metabolism and mitochondrial energy production. When it's lacking, metabolism slows down, leading to increased fat storage and sluggishness. Blood vessels weaken too, which raises the chances of high blood pressure, poor circulation, and clot formation. Up to 40% of diabetics on metformin are B12 deficient, and those with kidney disease are even more vulnerable. At the cellular level, B12 is essential for DNA synthesis, red blood cell formation, and nerve protection. It also fuels mitochondria, meaning energy levels crash when B12 is low. For natural sources, beef liver tops the chart, delivering a whopping 3,460% of the daily recommended intake in just 3 ounces, 85 grams. Clams are another powerhouse, offering over 7,000% per 3-ounce serving. Sardines provide 557% per 92-gram can, and wild-caught salmon delivers 208% in a 6-ounce, 170 grams portion. Even eggs, though lower, offer 23% per 2 large eggs, about 100 grams. Luxury meals that pack a B12 punch include truffle-infused clam butter over wild greens, offering over 5,000% per serving. Wagyu steak with caviar and sardine reduction delivers around 2,000%, and a decadent lobster bisque with wild salmon roe can contain up to 1,500%, ideal for an indulgent yet therapeutic meal. B12 absorption is best from animal-based sources. Plant foods, aside from unreliable fermented products, simply don't contain it. The most bioavailable supplement forms are methylcobalamin and adenosylcobalamin, which bypass the conversion issues of synthetic cyanocobalamin. Top supplement options include Geromethyl B12, 5,000 mg per lozenge, and pure encapsulations, Adenosylmethyl B12, 1,000 mg per capsule. Most diabetics, especially those on metformin, benefit from 1,000 to 5,000 micrograms per day. Be cautious. Certain foods and medications worsen B12 deficiency. Alcohol, processed grains, and sugary diets deplete it faster. Antacids, proton pump inhibitors, and high-fiber diets can also interfere with absorption. If you're feeling drained, noticing nerve symptoms, or struggling with mood swings, low B12 could be the hidden issue. Addressing it may be one of the most important steps you take. Now that you understand the impact of B12, let's move on to the final key strategy that brings everything together. When you step back and look at the big picture, it's clear these 4 nutrients aren't just small details in your health plan. They're the unsung heroes working behind the scenes every day. Vitamin A protects your vision, strengthens your heart, and keeps your immune system sharp. Folate, or B9, helps regulate mood, protect your nerves, and keep your kidneys functioning well. Iron is what fuels your energy and oxygen levels, especially when chronic fatigue starts creeping in. And B12? It's the powerhouse for your brain, your nerves, and your red blood cells. Together, these 4 nutrients form a foundational team, each one vital, each one with its own story. If you're struggling with brain fog, nerve pain, poor sleep, or stubborn blood sugar numbers, it may not be your willpower that's lacking. It could be what your cells are missing. Thank you so much for watching. If this video helped open your eyes to something new, hit the like button and let me know in the comments which vitamin you're going to focus on first. And don't forget to subscribe, we're just getting started. There's so much more coming to help you take control of your diabetes with simple, proven strategies that really work. Until next time, take care and be well.